A very good afternoon, everyone. And thank you so much for joining us this afternoon for the most essential and important session on Prepare to Act Essential CPR Techniques. Dr. Vandana Agarwal will not be available to take the entire session today due to a medical emergency. Instead, Dr. Shafi Subhan will continue the session and help us to understand what is CPR and what essential techniques are required to save someone's lives in a needful situation. Dr. Vandana and Dr. Shafi, the floor is yours now, and over to you.
Hello, everybody. Good evening. I'm Dr. Vandana Agarwal, emergency physician, Kim Sunshine. So I'm sorry, I'll not be able to take the entire session for you all, but definitely my colleague and friend, Dr. Shafi, will continue. Before he starts, I'd like to introduce one thing. See, there are three important components or aspects in handling medical emergencies. First is identification of the medical emergency. Second is the first aid or the treatment that we give to the patient. Third thing is transporting the patient to the nearest possible emergency room of the hospital. So, did anybody anytime got a chance to deal with any kind of a medical emergencies at home, workplace, or by roadside? Can someone answer me that? Is it possible? Okay, so we don't know exactly how to deal with medical emergencies. As a common person, we are scared to face this kind of a situations and how to deal with it, because it deals with something called as life, which is the most important thing in all of us. So we from Kim Sunshine has brought up a program, which is a live workshop, which we call it as Sachet Igniting Lives. We give you a hands-on experience, a training program about the medical emergencies. These medical emergencies can be cuts, burns, snake bite, stroke, heart attack, chest pain, anything. So if you want to be a first responder, then Sachet is your answer for that. To teach you, to train you, to spread awareness. For all these things, one stop is Sachet. So as a part of Sachet, today we are going to deal with a small topic called as BLS. BLS is nothing but basic life support. When do we do it? When a person gets unconscious or cardiac arrest, when the heart stops, what are we supposed to do? That is what we are going to take in this session of Sachet. So I would request Dr. Shafi to please continue with BLS and enlighten you all. We'll have a demo as well, along with few videos, so that it gets clear to you what you are supposed to do at the time of cardiac arrest scenario. Thank you so much.
Good afternoon all. I am Dr. Shafi, emergency physician at Kim Sunshine Hospital. So today we'll be dealing with what is a basic life support, what you call as a BLS, and why is it important for us. So basic life support. So what basic life support generally consists of is the assessment of the collapsed victim, initiating the chain of survival, and how to perform effective chest compressions. With that, parallelly, how to give a rescue breathing, and how to operate an automated external defibrillator, and in other scenarios, in how to relieve choking. So what is a adult chain of survival? So it's basically the immediately recognition of the cardiac arrest and activation of an emergency response system. Generally what cardiac arrest is, generally the heart generally stops. So what you will do is generally do, as soon as you see that the patient is unconscious, activate the emergency response system, and then checking for the pulse, which I'll show in the next slides, and then doing an early cardiopulmonary resuscitation with emphasis mainly on the chest compressions. Then the other thing is the rapid defibrillation, the effective advanced life support, and the integrated post-cardiac arrest care. Concept of CPR. CPR is generally initiated to the patients with a cardiac arrest. CPR generally is, the full form is a cardiopulmonary resuscitation, cardio related to the heart, pulmonary related to the lungs, and resuscitation is the revival. So what you will do is basic. First, initially what is important is the scene safety. For any patient, any unconscious patient, you should see that there is a scene safety. There is no fire. There is all the wherever you're doing a CPR, the scene over there is safe, so that there is no harm to yourself. And then assess the response. You will tap and see either he's responding or not. Once he's not responding, again you will look for the pulse. With that, parallelly, you will look for the breathing. Immediately, when you see that there is no breathing, there is no pulse, you will immediately activate the emergency response system and start the CPR. As you can see in the images, you just shake the shoulders gently and say, "Are you all right?" And if he responds, well and good. But if he doesn't respond, you reassess and then check for the pulse. And then you start the CPR, that is a 30 chest compressions. As you can see here, check second image, approach for the safety, check response, shout for the help, and then you will open the airway to give a proper breathing. And then you will start with the chest compressions. And then with 30 chest compressions, generally you give 2 rescue breathings. This is the most important thing. What is the assessment step? Step 1 is the assessment of the scene safety. You will not do a CPR in between so much crowd or something. You will make sure that there is in between so much traffic, suddenly unconscious patient in between this so much traffic, you will make the patient, move the patient towards a scene, safe scene, and then you will start the CPR. Second thing is immediately you see that there is no pulse, the patient is unconscious, he's not responding, you will immediately activate the emergency response system. Now, how you check the pulse? The pulse initially, you can see these 2 images. You will put your 2 fingers, the index finger and the middle finger, towards the side of the neck, just below the our jaw, and then from the neck 2 centimeters, 3 centimeters from the neck, you can just slide from the center of the neck and you can feel the pulse. That is a carotid pulse. That is a central pulse which we feel. As you can see in the images, the arrow showing the center of the neck, 2 to 3 centimeters. You can just slide and then you can feel the pulse. Now, once there's no pulse and then you feel that the patient is unconscious, there's no pulse, there's a cardiac arrest, then you can go ahead with the chest compressions. That is, you will start at 30 chest compressions. With every 30 chest compressions, once the 30 chest compression finishes, you will be giving 2 breaths. Every 2 breaths you will be giving. And the 30 chest compression, you will be counting aloud, so that you will know that with every 30 chest compressions, you are giving 2 breaths. How the chest compressions now are, you will position yourself at the victim's side, and then you will start the chest compressions. Within, generally you see, for the pulse assessment, you will just give it 2 to 5 seconds for the pulse to be checked. Once you see that within 5 seconds or maximum 10 seconds, you see that there is no pulse, immediately you have to start the CPR within 10 seconds. How you start the CPR is, chest compressions is push hard and fast at the rate of 100 to 120 per minute. That is 100 to 120 per minute. And then you will press down at least 5 centimeters, so that there is a proper recoil, so that when you're doing a CPR, the heart gets pumped properly. So it should be at least 5 centimeters down. And with every compression, it should be a proper chest recoil, meaning after you do the CPR, it should come back. It's not just pumping the heart, it's not coming back. You do the compression and then it has to come back. So that's called a complete chest recoil. And the main important thing is minimizing the interruptions between the compressions. The less the interruptions, the more the chance of survival, and the patient can come back. And opening the air is the opening the airway, because in unconscious patients, the tongue tends to fall back. So there is an obstruction. So you will try to open the airway. So you can see how the airway is being opened. The first one is a blocked airway, because the tongue is falling back. And then you will open the airway, giving a jaw next, which I'll show you in the slides. You will, yeah, you can see that. You will jaw thrust and head tilt. This one. The previous one is being demonstrated here. You will head tilt and chin lift. And with that, you will be giving a jaw thrust so that the airway has been released. So this was the blocked one. This is the open airway, which is being demonstrated here to open the airway so that with the chest, 30 chest compressions, you're giving a proper airway. Now, how you will give the breaths is, and generally in one rescue and two rescue. Suppose you are a single person. So how you will position is, you will position yourself towards the victim side. And then you will place the mask over the victim's face and you will achieve a proper seal and deliver one breath over 1 second to make the chest rise. And you should make sure that the chest rise is proper. That is in the one case scenario. In two case scenario, one will be doing the CPR, one will be doing with the chest compressions, and one will be at the breathing position at the head end side, giving a breath. So in that, you will position again at the victim's head. You will place the victim mask over the victim's face, and you will properly seal in an EC clamp. You can see in the image EC clamp. He is making a C with his thumb and index finger, and C with that, and the E is on the jaw. The three fingers are on the jaw, so that three fingers will lift the jaw. That thumb and index finger will hold the mask, and with the left hand you will be bagging so that you deliver one breath every 1 second to make the chest rise. With that, immediately you will connect. What you will connect is a automated external defibrillator, what you call an AED. AED, generally you will first turn it on. Once you turn it on, the defibrillator will give you have to follow the prompts. Once he analyzes the rhythm, then he will say whether to shock the patient or not to shock the patient. This is how you see. What you will do is you'll power on an AED. You will attach the AED pads on the chest. We will show in the video and the demonstration. And then once the pads are put on the chest, the defibrillator will analyze the rhythm. Once the rhythm is analyzed, no one will be near the victim. Everyone will be away from the victim because the shock has to be delivered. So everyone will be away from the victim, and once the rhythm, that is the heart rhythm, which is on the defibrillator, is being analyzed, then you will press the shock button and the shock will be delivered. But if the AED machine doesn't prompts for any shock, meaning that rhythm is not for a shock and you have to continue a CPR. The CPR has to be continued till the defibrillator analyzes the rhythm. Continuing resuscitation till the qualified help arises and takes over and the victim starts breathing normally. So generally a CPR or a cardiopulmonary resuscitation, chest compressions and all is a team effort. So what you will do is you will be doing one will be doing a chest compressions, other will be changing the person after every 2 minutes, because doing a CPR is not so easy. So once 2 minutes finishes, you can change the position. You will get tired because if you give the same person, he continues doing the CPR, the quality of CPR will not be there. The person will be tired. So it's better to keep changing every 2 minutes. And then keeping a track of number of compressions, how much compressions you're doing and how many breaths you're doing. That is a proper teamwork, as you can see in the images. One is doing compressions, one is on the breathing. In such scenarios, if the person who is doing a chest compression is tired, he can go on to the breathing, and the person with the breathing can do the chest compressions. This is generally an algorithm for a cardiac arrest patients. So first thing is what we will see is verifying the scene safety. And then you'll see a patient is responsive or unresponsive. Once the patient is unresponsive, you will shout for a nearby help. And then you will activate the emergency response system via a mobile device if there, otherwise mostly mobile device, or nearby if you can see any other person, you can just shout for the help. and then get an AED and then emergency equipment. And then you will monitor until the emergency response arrive. If there's a normal breathing and pulse pulse, you will monitor. But if there is no breathing or only gasping and checking pulse, if there is no pulse again, you will start with the CPR, that is a chest compressions. And then you'll be checking for the pulse every 2 minutes. With every 30 compressions, you will giving a 2 breaths. The next thing is, if he has a pulse, then you can just give him he's not breathing properly, you can just connect. You can give him 1 breath every 5 to 6 seconds. That is around 10 to 12 breaths per minute. And then in the meanwhile, you can activate an emergency response and then wait for the emergency responders to come. And then again, once the other thing which I have told you, once AED arrives, you can, for the shockable or a non-shockable rhythm, once if it is a shock, you can give a shock. And even after shock, if there is no pulse, resume with the CPR, that is the chest compressions, until the further AED, second time AED check. If there is a non-shockable rhythm, it says that shock doesn't say for any shock, then you will have to continue the chest compressions until the pulse comes back or until the ALS providers has been coming. So it's like how much ever you give a proper CPR, how much chest compressions you give, less minimize interruptions, that will be beneficial for the patient. Generally, for the pediatrics and adults, it is the same thing. But the only difference is in case of the adult pediatrics, in case of compression for the 2 rescuers, it will be 15:2. Yani it will be 15 chest compressions to 2 breaths when it is a 2 rescuer. But in case of 1 rescuer, it will be the same. That is 30 chest compressions to 2 breaths. And it is the same thing, 5 centimeters deep and proper chest recoil, and to activate the emergency response as soon as possible. Again, regarding the adult and child or infant, when adult, it is breathing pattern. It is 1 breath every 5 to 6 seconds when there is a pulse. This is only when there is a pulse. Every 5 to 6 seconds, 1 breath. And infants, it is 1 breath every 3 to 5 seconds. And giving each breath in 1 second. And you should make sure that once you're giving a breath, that there should be a proper visible chest rise, and checking the pulse every 2 minutes. Even initially the pulse can be there, but when you're giving a breathing after 2 minutes, you need to check the pulse. Once there is no pulse again you will have to go back to the initial thing, start a chest compression, that is a CPR. Choking. The universal sign of choking is, you can see as in the images. So suddenly he says that choking and suddenly he falls unconscious. Then again, you will have to start a CPR. But if there is a pulse and he's showing a choking with the hands on the neck, then what you can do is you can just put your hands, you can go back, put your hands below his abdomen, basically below his ribs towards the abdomen, and give him a 5 abdominal thrust. You can just give him an abdominal thrust. You can see the arrow which is pointing out, the second arrow which is pointing out to the fingers. That is that you will be compressing the abdomen. 5 times you can give a 5 thrust, abdominal thrust. That is basically called an Heimlich's maneuver. So that whatever any foreign body which is stuck in the throat, that can be released.
Position yourself at the victim's side and make sure that the victim is lying face up on a firm, flat surface. Quickly move or remove all clothing from the front of the chest. You will need to be able to see the chest and later attach an AED to bare skin. Put the heel of one hand on the center of the bare chest over the lower half of the breastbone. Then put the heel of your other hand on top of the first. Your shoulders should be right over your hands and your elbows should be straight. Push hard and fast. Press down at least 2 inches or 5 centimeters with each compression. This requires hard work. For each chest compression, make sure you push straight down on the victim's breastbone. Deliver compressions in a smooth fashion at a rate of at least 100 compressions per minute. At the end of each compression, make sure you allow the chest to recoil completely. Chest compression and chest recoil times should be approximately equal.
Position on a firm surface. Properly performed CPR produces only 25 to 30% of normal blood flow. Doing compressions correctly is very important. With your shoulders directly over the chest, press straight down. Compressions should be regular and smooth, half compression, half relaxation. A common error is the rocking chair technique, where compressions are done from the side instead of straight down. The arms should be kept straight, with the elbows locked. Bending the elbows soon tires the arm muscles. The natural weight of your body should be doing the work. Keep the heel of the hand on the sternum at all times. Compress and release in a steady rhythm. Bouncing compressions are less effective and are more likely to cause internal injuries. Keep your fingers off the chest. Use the heel of the hand only. Massaging or pressing on the chest with the fingers may cause rib injury. Another hand error is the crossed hand technique, which makes it difficult to keep the correct position and pressure on the sternum. Avoid these common mistakes when performing chest compressions. Don't be a rocker, a bender, a bouncer, a massager, or a double crosser.
Right. That is what is shown in the video, because CPR is chest compressions are very important when the patient is in cardiac arrest, because the heart needs to get pumped properly. So if you're very fast, too fast, and if there is not a proper chest recoil, meaning once you give a compression, if it doesn't come back, meaning there is not a proper recoil and the heart is not getting pumped. So in hurry, the chest compressions won't be a proper quality. That has to be monitored. And the elbows and your shoulder, it should be straight. It should not be bent. Anything bent means you're not giving a proper chest compression. The heart is not being pumped properly. So this was the BLS and the chest compressions from my side. So any questions?
Thank you so much, Doctor, for the wonderful presentation that you have shown to us.
Yeah.
So before we quickly move to Q&A section, I would like to take this opportunity to launch a feedback poll. So this feedback poll will help us to curate many more sessions like this. And I request everyone to answer the poll that you see on your screens. And if anyone wants to ask any questions to Dr. Shafi, you can just raise your hands so that I can move you to panel and you can ask your question directly to the doctor. And in the meantime, we have a couple of questions in the chat box, Doctor. So
Yeah.
the first question is, what is the purpose of AED?
AED is necessary because that is an automated defibrillator. Defibrillator meaning it will analyze the heart rhythm, like what the heart rhythm is. Is it absolutely flat line so that there is no rhythm and the heart needs to be pumped, or there is some rhythm going into the heart which can suggest that get shock to be given at that time, or it is not a shockable rhythm. So that generally analyzes the heart rhythm, because the heart will be stopped. But some activity after giving a CPR, there will be some activity to analyze the heart rhythm after the CPR that is necessary. You can see this. Once the infant chokes, initially you can just take the infant, and then you can see if there is any, you can just see with your eyes if there's any foreign object in the mouth which is choking him. But you will only put the finger in the mouth only when you can see it. You will not manipulate, or you will not just blindly put to see if anything is there. Once you see that it is not visible, then you will keep the child on your lap. As you can see in the first photo, you can keep the child on the lap, and then you can just give him a 5 taps on the back, and the head, one hand will be on the face. That is, you can see the left hand which is on the face from the back, and then your right hand will be tapping the back, so that you'll give 5 back thrust, back tap, so that if any foreign object is there, that will come out. And once you feel that after that choking is there and there is no pulse, and the second position is the CPR. What you will have to do the CPR. You will hold the child head with the one hand, and with two fingers, because child is very small, so CPR in a child will be done with two fingers. So two fingers will be doing the CPR. Again, that will be again one rescuer. If it will be 30 chest compressions you will be doing.
Thank you for that answer, doctor. And one more question from the chat box is, why cardiac arrest happens even if a person is fully fit?
See, cardiac, when a person is fully fit, he might be fit, but suddenly he can have a fully fit. Generally, they don't tend to land up in cardiac arrest unless and until there is some issues with them. They might be having chest pain, which they might be thinking that it is not a chest pain, it is just some gastric issue. That is one thing. Other thing is suddenly they might have a sudden giddiness or something sudden due to maybe they didn't take a proper meal. Suddenly it can land up into low BP. Low BP can low hypotension, which you call, that can land up and not improper blood supply to the heart, and suddenly that can cause a cardiac arrest. Those are the two mainly things, but fully fit patient generally landing up in cardiac arrest is less likely, but less likely those.
Got it. So another question from chat box is, Lavanya Parmeshwara is asking, what happens if the person is unconscious due to low BP? Can CPR helps?
No, the thing is, if the patient is unconscious and low BP, the first thing what you will do is you will check for the pulse. As I showed you initially, you'll check for the pulse and the responsiveness. If the patient is responding and there is a pulse, then you can just give him some initial juice or something, or else if he's not much conscious but he has a pulse, then you can give him IV fluids so that the BP improves. But initially you can give him some juice or some salt water so that the BP improves. But again, you will have to check for the pulse and go ahead. And CPR will only have to start when there is no pulse.
Got it. So we have Malavika. She is asking that, can we get certified via hospital in CPR and emergency aid?
Yes, definitely. There are American Association CPR courses which give you BLS and ACLS certified. So once you do this course for 3 days, you will be certified as a CPR provider, BLS and an ACLS provider, which is a 3-day course. So you can be certified. You do get a proper cards, BLS card and an ACLS card.
So one interesting question is, Subha is asking that if a person is afraid to do the CPR, how can we overcome out of that?
See, how you can overcome is, you will have to think, like, for example, if you have a scenario by God's grace, if you have a scenario at your home, then there's no option that if no one is there, you will have to do a CPR. So once you start doing a CPR with someone's help who knows the CPR, then your confidence will gain and your fear will come out. I agree, alone doing CPR is a little, some people do panic, but when the CPR is being done by some person who is expert in that, you can just go with them, practice it, then your confidence and your skills will improve.
Got it. And Vishwanath Bhupati is asking how to unblock the airway of an unconscious person.
As I showed you unblock, how do you unblock is, you will do the head tilt, you will tilt the head and the chin, and then you will do this jaw, you will thrust it so that your tongue, which is falling back, moves up and the airway is open.
Okay. Arpit Jain is asking, what was the impact of COVID, or the person who has taken vaccine, they are likely found to be more such attacks? Why it is happening?
Vaccine relating to such cardiac arrest, I don't think it is anything relation with the cardiac arrest and vaccine. Maybe the people who has taken vaccine, they had predisposing factors of hypertension, diabetic, or smoking, or alcohol, or such, or previous any heart issues which they had, that could trigger them for a cardiac arrest. But vaccine causing and cardiac arrest is not a possibility.
One more question from the chat box says, Sagar is asking, nowadays we often hear that the person has cardiac arrest while doing gym. What's your views on this?
The two things are there in such scenarios. Doing in gym cardiac arrest, some people tend to do gym in such a way that they tend to do it in a very fast way. The initial they don't have an habit of gym, so they do go to the gym, they do the cardio, that is they do the running, they do the jogging in such a fast manner that the load on the heart is too much. So when the load on the heart is too much, suddenly the heart cannot bear it, and suddenly they can land up in cardiac arrest. So going slowly after going to the gym, and you're not a frequent gym person, slowly starting a cardio is much better. So that is a point you need to see.
Great. Thanks for the answer, doctor. And one more question from Rajesh. To avoid any heart-related issue, is it recommended to do a cardiogram at regular interval? What is the interval we need to consider?
See, the thing is, you have to see your lifestyle also. If you have you have a good lifestyle and all, then that every 3 months one cardiogram is better. But if you feel that you have an hypertension, diabetic, and you feel chest pain anytime, then you can immediately get a cardiogram. Otherwise, every 3 months, it's advisable to get a ECG. That is a electrocardiogram.
And one question from Mohammed Sufyan is, what if the pulse is dropping continuously after cardiac arrest?
See, sir, cardiac arrest is basically the cardiac arrest itself is there is no pulse. The pulse, there won't be when the patient has a cardiac arrest, there won't be pulse at all. So there is no chance of pulse dropping. There will be no pulse. But once a cardiac arrest is there, meaning there is no pulse, so you will have to start with the chest compressions. By anyhow, you have to start the chest compressions.
Got it. So
Yeah.
Jinder Singh is asking, what is the difference between cardiac arrest and heart attack?
See, cardiac arrest is completely stopping of the heart. There won't be any pulse in a cardiac arrest. But heart attack is generally happens due to this blood supply to the heart is being obstructed. Either it can be due to any high cholesterol levels or suddenly blocking the heart vessels. That is called a heart attack. But cardiac arrest is generally the heart completely stops and there is no pulse. But in a heart attack, there is just a reduced blood supply to the heart due to obstruction of the vessels, and there will be pulse. So that can be curable by doing a proper angiogram.
Okay. So Sagar is asking a question that how can we define a person is actually having a chest pain or it is a gastric problem?
See, that is one of the most people ignoring nowadays. They think that every chest pain, they think that it is a gastric pain. But no, if you feel that there is a chest pain, there's a burning sensation and chest pain, and you have sweatings, you have a neck pain, you have a pain radiating to the left arm, you have the pain you have shortness of breath while walking or by lying down, then better that this are symptoms that there is suggesting in terms of the cardiac chest pain and not a gastric chest pain. And if it is gastric chest pain, taking just an antacid, it will reduce. But cardiac chest pain, even after taking an antacid, it will not reduce, it will be continuous. The pain will be continuous. So better to immediately get an ECG done as soon as possible to rule out any cardiac activity.
Thank you so much, doctor, for that wonderful answer. We'll wait for a couple of minutes for the audience.
No
If
issue.
anyone want to ask any questions, if not, we can end the webinar. Just a couple of minutes.
Yeah.
Look forward. Audience, from the audience, if anyone want to ask any question, you can type it in the chat box or you can raise your hands so that we can move to the panels. So you can ask your question directly to the Dr. Shafi here. So I request audience, if you have any questions, please raise your hands. So Priyanka is asking that, can you help us with some regular tips to keep our heart healthy?
Generally, the most important thing is keeping your lifestyle very healthy, eating a good diet, less oily, less fatty diet, and then having a good at least morning and evening, at least 10 to 15 minutes daily walk, avoiding alcohol and avoiding smoking. That will, and avoiding stress. The stress is the main thing. So avoiding stress and having a good sleep, around 8 to 10 hours of sleep, that will help your heart health, keep your heart healthy.
Thank you so much, Dr. Shafi, for answering all the questions patiently, and we have some more questions. So Nilesh is asking, is there any impact of frequent ECGs, as you suggesting ECG for every 3 months?
There is no impact. See, unless and until you feel that there is any chest pain, anything you can get within 3 months, or else you can wait and get every 6 months. And again, depends on your complaints. And taking after every 3 months ECG will not have any impact on your body, but it'll just keep you a safe side. If you still very anxious or you want to get it checked, you can get every 3 months.
Got it. So Sanjay Rani is asking, she is 27.
Yeah.
She is feeling vibration in her heart. Could this be a sign or any acidic issue?
See, vibration in the heart, it can be stress related as well. You will have to rule out that you're having a lot of stress, any lack of sleep, other thing, because you're just 27. So it could be an stress related, it could be an acidic issue, but I would still suggest to get an ECG just to be on the safe side, to rule out any cardiac activity. Once the ECG is normal, the electrocardiogram is normal, then it's just acidic and just stress related, nothing much.
Thank you, doctor. And one question from Vasu Balaji. For their parents, TMT signaled marginal positive ischemia. Doctor started statin. Any recommendation from your end?
That's what, as TMT has already signaled marginal positive ischemia, meaning there is some damage, meaning the positive ischemia, meaning there is an heart attack. There is a mild heart attack which is going on. So better to start those and what doctor has already started her on statins. So statins will generally help her cholesterol levels, which will generally cholesterol levels fluctuation generally causes this heart attack. So starting the statins and also this aspirin and all what you call antiplatelets and all will definitely help the patient because it is just a marginal positive. So starting the immediate medications will definitely help them.
So Rajesh is asking, what is the probability of blockage again in coronary after placing stent?
That again depends on your lifestyle. Smoking, people who even after placing a stunt, people do smoke continuously. They do take alcohol. They do tend to eat a lot of oily and a fatty food. So that tends to keep form those again block those stunts again. So that you need to see that you take a proper medication and you take a keep a proper diet and do a lifestyle. And I don't think after in spite of taking that, then it will not be blocked. But if you're irregular in your medicines and your activities, then definitely there are chances that those stunts can again get blocked.
So one question from Ramesh, ECG can predict any forthcoming heart attack.
Yes, ECG can definitely predict a forthcoming heart attack, in the sense if you have a chest pain, you get an ECG and ECG showing some minor changes, meaning initially there are some minor changes suggesting of an heart attack. So better to get those initial investigations done, like some blood test and 2D echo, what you do, and then you immediately start the low dose medicines, so that further your heart won't be affected, your heart function won't be affected.
Thank you, doctor. We have Sridhar asking that what is the appropriate time to start CPR on a faint condition?
So once you see that the patient is faint patient, meaning an unconscious patient, the most important thing is to check for the response. As is you're telling faint, next important thing is to see for the pulse. Once there is no pulse, within 5 seconds, you have to start the CPR, so that you give a proper pump to the heart, so that the heart can pump back to the brain as well. So within 5 to 10 seconds is the appropriate time.
One more question is, does reducing weight help cardiac health?
Definitely, keeping your weight under control. Obesity is one of the major cause of heart attacks nowadays. So keeping your health weight under control will definitely keep your heart also healthy, and help your heart. What do you say? Put a less load on your heart.
Thank you, doctor. One last question from Priyanka. Can you suggest some ideal foods for healthy heart?
Yeah, I have told you, right? So taking just a healthy heart means you just need to take a good diet, avoid excess of fatty foods and oily foods, and avoid smoking, and just have a 10 to 15 minutes morning walk and a evening walk, and just keep yourself stress free.
Thank you so much, doctor, for answering all the questions patiently. And with this, we came to an end of the webinar.
Yeah.
So once again, I thank you so much for the wonderful presentation and taking time for us and doing such a wonderful session for us. So this really helps us to act accordingly when a person needs our help. So thank you so much once again. And I thank all the audience for attending the session. And next week, we are coming with a topic on art of business storytelling. So see you all next week. Thank you, doctor. Thank you so much.
Thank you so much for the opportunity. Thank you so much.